Most questions were pharmacology, very, very basic pharmacology. We saw a few questions which were on Drug and Cosmetic Acts, and some history, very few history of pharma we saw. So today we will be seeing a mixture. We will not see a lot of chemistry topics because I think structures, what I understood from yesterday was we have to deal with chemical structures at least as an overview, and then go forward for questions. So okay. So that's what we are trying to do today. Okay. Okay, so everybody is comfortable with English, or Tamil also is? You want me to explain few things in Tamil also? You can raise your hand or message. Okay. Okay, so I will try to, if there is something a little complex, then we can try to do it in Tamil also. But just in case, if you find anything that you don't understand, please please stop me or put a message, so we can deal with it. Okay. Okay, so shall we move forward with questions now?
Okay.
Okay. Okay, fine. Okay. Okay, the first question for today will be subcoatings given to tablets. Why are subcoatings given to tablets? Any thoughts before we go into the options? Nothing. Okay, I'll just give you the options. To increase bulk, to avoid deterioration due to microbial attack, to prevent the solubility in acidic media, and to avoid stickiness. So what do you think the answer is?
To prevent solubility in acidic media.
To prevent solubility in acidic media. Okay. What else? Okay, so what is basically a coating? Okay, Priyadarshini has answered. Then, okay, I think Nisar is the one who said prevent solubility in acidic media. Okay, so that is when we use solubilizers, no, as an additive. So in case of coatings which is given, it is for a different reason. Basically, okay, I'll tell you the answer. The answer is to increase bulk. Okay, you have the active pharmaceutical agent inside, but it may not be as palatable as you need to take it. You just can't pop it in your mouth if it does not have smooth surface to it, right? So in order to attain that smooth surface, you need to add a coating. So a coating in the form of dusting powders, sometimes in the form of sweetener, but not too much. For the it will not go above the maximal limit. So in order to give a proper coating, I mean to give round edges, so that you don't have pointed tablets which go and get stuck into the throat, subcoatings are given. There is no set what do you call percentage of coating that is to be provided. Coating can be different for different drugs. For example, some drugs, when you coat it, it is enough for them to make it round, so that the edges are not very sharp. But for some drugs, you will require. Okay, sir, should I wait or move forward, sir? Continue. Okay, fine, sir. Okay. The next question is, pyrogens present in containers can be destroyed by heating the containers at. So pyrogens are basically organisms which may cause elevated temperatures in our body, and it may be present anywhere. So especially in hospitals or pharmacies where we deal with injections and sterile glasses, we will have to destroy them by heating. Now we get sterile preparations by itself, but when we do have a manufacturing setup, then we will have to know the answer for this. So I'll give you the options. 121 degrees Celsius for 15 minutes, 121 degrees Celsius for 30 minutes, 210 degrees Celsius for 4 hours, 210 degrees Celsius for 30 minutes. So you can give me your answers. A, okay. Let's wait for everybody to, some at least 3-4 people to answer. B, okay. B, okay. Most of you are telling B. A, okay. This is a little tricky question. 121 degrees Celsius usually we use for autoclaving. So pyrogens are very heat resistant, especially when they are on glass containers. You will have to provide a higher temperature for them. So it is 210 degrees Celsius for 4 hours. So initially it was 250 degrees Celsius for 30 minutes, and then they give an interval, and then they give back again 210 degrees Celsius. So that goes on for around 2.5 hours. Then this process was revised, and at present what is followed is 210 degrees Celsius for 4 hours. So what we should remember here is pyrogens are not exactly microorganisms. Okay, so it is slightly different. So they are endotoxins, so their outer cell wall is slightly thicker than the other bacterial agents. So they require higher heat, higher temperatures for to be destroyed. So the answer is 210 degrees Celsius for 4 hours. Okay, following everyone?
Okay.
Okay, yeah. So we'll move to the next question. Which of the following drug comes under orphan drug category? Examples, options: clofazimine, salbutamol, clozapine, tropicamide. Okay, so before that, can anyone tell me what an orphan drug is? Or an orphan disease?
Drug used to treat rare diseases.
Rare diseases, okay. What about orphan? So any example for an orphan disease can you give me?
Amphotericin B.
Amphotericin B is an antifungal agent which we use. It is not an orphan drug. Can you give me an example for an orphan disease? What is a very rare disease?
Rare disease.
You can think of any form of cancer. Sorry.
No.
No, anybody else? Okay, so we may have not heard much about these diseases. Most of them may be congenital diseases. There is one disease called Bloom syndrome, and there is something called Tourette syndrome, which affects your vocal muscles. Okay, and I think most of you have heard about cystic fibrosis. Cystic fibrosis will affect Okay, so our liver can get affected in cystic fibrosis, and in case of disorders which is related to muscles, then we have Duchenne muscular dystrophy. So most of what is known is something related to skeletal muscles, which affects our skeletal muscles. Those also come under orphan diseases. Now for orphan drugs, it is a slight hemophilia. Priyadarshini is not an orphan disease because we see hemophilia in the incidence of hemophilia is much higher. So it is more like you see probably 20,000 to 30,000 cases according to USA. If you see that in their population per year, if you see only 20,000 patients presenting with one particular disease, then they term it as orphan disease. So we do not have a category as such. We are also following them. Okay. Okay. So so we have the answers. Salbutamol, clozapine, tropicamide. I don't. It may not be right. Salbutamol again, bronchodilator. Clozapine. Clofazimine. Yes. Clofazimine.
Leprosy, treatment of leprosy.
Leprosy, correct. So it is not for all forms of leprosy. It is for multibacillary leprosy. So it is used. Okay. So that is an answer. So clofazimine is the answer. So I can probably give you a few more, even for some. See, these orphan drugs keep changing. It does not always fall into the category. Earlier, even rituximab was considered as an orphan drug, but then after wide usage of rituximab in osteoarthritis and diseases like that, it is not anymore considered as orphan drug.
Liothyronine is an liothyronine.
Liothyronine, I think it has been recalled. I don't think it is in use now. Is it in use? I'm not very sure.
Okay.
Have you seen it in this one being given?
Parenteral preparation T3. Thyroid.
Oh, tyranine. Okay. Tyranine, yes, but that is not orphan drug because
T3.
T3. Yeah. It's a prodrug which gets converted to an active drug. Yes. But that does not come under orphan drug categories. We have very limited orphan drugs which is used. So I'll probably give you a list of orphan drugs which we see in India at least. So for you to remember a few, it's quite difficult for us to remember everything. So probably 5 to 10 I'll give you. Okay. Yeah. So let's move to the next question. Dimethyl sulfoxide acts as a penetration enhancer for topical formulations by. Before going to the options, are we aware what dimethyl sulfoxide is? I mean, where do we see it? Anybody seen on any labels? It may be written as DMSO. No, I think probably we can see in our moisturizers, in our sunscreens, and in any topical formulations, especially if you have corticosteroids in it, then DMSO is mostly present. Okay, so let me give the options. So the question is, how does DMSO act as a penetration enhancer? Okay, so the options are denaturing proteins, increasing solubility, increasing transepidermal loss, altering solvent nature of the membrane. So you can think about this. Anybody? Any answers? What happens? Just see, we have mentioned as penetration enhancer, right? So think in that lines. For it to penetrate, what needs to be done?
Increasing solubility.
Not exactly. So not exactly increasing solubility.
Okay.
Can you think of something little more logical? We have our skin. What is the most important layer of the skin that we have?
Increasing transepidermal
Epidermis.
Epidermis. What does epidermis consist of?
thin layer.
It has a lot of proteins in it, right?
It is a outermost covering of skin.
Yes, outermost covering, which has a lot of proteins in it. So the initial step for any particular formulation to go inside our skin will be, it should pass through the epidermal layer. Okay, so how does it do? What dimethyl sulfoxide will denature the proteins. It will kill away the proteins to enter inside. Okay, we may also be confused with increasing transepidermal loss, but what happens is in skin related conditions, best practices are not to lose any of the epidermal layer, or uh, any of the epidermis loss is not going to happen. Okay, so we do not kill away our fatty acids because it is very protective of our skin. Okay, which may cause irritation if at all there is any transepidermal loss happening. Transepidermis will contain a few lipids and fatty acids also, so that is not ideally preferred in any formulations. Penetration, it needs to penetrate first, right? So it will denature all the proteins and then move forward to the other layers. So the answer will be denaturing proteins. Okay, got it? Can we move forward? Okay, so let's go for the next question. Schick pest toxin is a sterile filtrate from a culture of
Diphtheria.
diphtheria. Very good. Okay, so that is the answer. So what kind of diphtheria? I'll give you options: Actinobacillus mallee, Mycobacterium tuberculosis, Rickettsia prowazkii,
Corynebacterium diphtheria.
diphtheria. Okay, so as you said, it is diphtheria. So okay, now can anyone tell me how Schick test is done? Why is Schick test done?
Diagnosis for diphtheria.
Diagnosis for diphtheria, yes, but for you to remember any instance that you have, that you can tell me, for so that we can all remember it.
No.
Any history that you're aware of?
No.
Okay, so what the Schick test basically does is, it's a diluted diphtherial toxin. Okay, so what happens is, initially when diphtheria vaccine was invented, it was not very mandatory, but people, I mean, physicians and the government was implementing it and providing more awareness to it. So at that time, in order to check if a particular child is been vaccinated, they used to test for this. Okay, so if at all there are any diphtherial, I mean, if you're given vaccine, then you will have diphtheria antibodies in you, right? So they used to test if there is any diphtheria antibodies by injecting around 0.1 ml of this toxin. They would wait and see. So it is quite similar to Mantox test, which is done. Okay, it is there will be a skin pustule which will be seen. So in this case, there is also a control. Okay, Shashi Kumar has raised his hand. Any concerns, Shashi Kumar? Yes, Kaushik also. Okay, yeah, you can probably type it out. Okay. Yeah, so there is also a control which is given to the other arm to see if there is any difference. So this is just a brief history so that you can remember it. You don't have to we don't have to mug up what is a Schick test and all. Okay, so okay, from yesterday's class, what is a test for Mycobacterium tuberculosis? Mantox test. Okay, fine. So rickettsial disease. Okay, rickettsial disease, we do not have a particular name for the test. So even actinobacillus also, we do not have a particular name. So the answer here is Corynebacterium diphtheriae. Okay, let's move on to the next question. Violin gut is obtained from intestine of. So what are you aware of violin gut?
It's a suture.
Suture, okay. Any idea why it is called violin gut? Something very, very logical it is. Goes by the name.
Violin
Yes.
thread.
What? Violin thread. Yes, exactly.
Violin thread.
Yes. It is violin strings are made of these intestines. Okay. So let us see from which animal that it is being taken. Cow, horse, sheep, camel. So your answers, please.
Sheep.
Sheep. Okay. Any other answers? Cow. Okay. A. Okay. So I'll give you the answer. The answer is sheep. So sheep, intestine of the sheep is being taken, and it is made into thinner strings and fibers, which is mainly in medical purpose. We use it as sutures and ligatures, but not much in use now. And it is also used because of because of the thickness that it provides. It is very, you can't call it elastic, but it is very rigid in nature. So it is also used in the violin strings. So in medical practice, in order to hold together a skin or or an epidermal layer in the form of suture, violin gut was used earlier. Right now, I think we have other chemical forms which are being used. Okay. So it is obtained from sheep. Okay, let's move on to the next one. Choriocarcinoma is a cancer of, I'll give you the options: womb, eye, kidney, bone marrow. So any thoughts? Womb. Womb. Okay. Anything else? Eye. Okay. Just think about it. Eye. Okay. So most of you are telling, I mean, it's eye and womb. Some of you are telling eye, womb. Okay. Have you heard about chorioamnionitis? Okay. So, okay, in short, I mean, the answer, I'll just give you the answer, then we'll discuss about it. It is a cancer of womb, or for easier terms, we can also tell cancer of uterus, but it is not rightly preferred. We cannot exactly call uterine cancer because this happens only when the mother is pregnant, and it is sometimes considered a very deadly condition wherein they lose the baby and the mother. There is no particular drug treatment or chemotherapy for this choriocarcinoma. It is widely seen in Western countries. Okay, so you can what you can understand is CHORIO. You can synonym it with placental cord. So it is similar, no? The word chorio and placental cord is similar. So you can just remember it like that: chorio, cord. So cord is something which attaches the mother and the fetus together. So it is a cancer of the womb, meaning with along with the placenta, the baby and the mother will be affected. Yeah, in this case, again, another thing is the baby may or may not be affected. The baby may or may not be delivered. Usually the chances of deliveries does not happen. They usually terminate the pregnancy quite early. So that is, choriocarcinoma is a cancer of womb. Okay. Nisar Ali, you have anything to tell? Okay, I have not heard from you. Okay, fine. Let's move forward then. Monoclonal antibody used for the treatment of breast cancer is sorry, alemtuzumab. Examples: trastuzumab, rituximab, and gemtuzumab. So just give me your thoughts about this. Monoclonal antibodies used for the treatment of breast cancer.
Trastuzumab.
Trastuzumab.
Trastuzumab, okay. Prabhu says it is rituximab, okay. Okay, so I think in the beginning of the class I used the term rituximab. For what did I use? For what treatment rituximab is given, if anyone remembers? Very common disease when we were discussing about orphan disorders. In some form of rheumatoid arthritis, rituximab is given.
Rituximab is used for arthritis.
Yeah, rheumatoid arthritis, not osteo, only rheumatoid arthritis. So we do not use rituximab for breast cancer. So we are left with three other options: alemtuzumab, trastuzumab, and gemtuzumab. Okay, so I'll give you the answer. The answer is trastuzumab. So trastuzumab is for breast cancer, whereas alemtuzumab and gemtuzumab is for blood-related cancer. Especially gemtuzumab is given for non-Hodgkin's lymphoma. Okay, there are a lot of clinical trials which has happened on this, and it is proven to have very good results. So gemtuzumab and alemtuzumab.
That other two drugs coming under which category of antibiotic? It is
No, they are all monoclonal antibodies.
Oh, especially used for only breast cancer. Trastuzumab is
Yes,
used.
yes.
Okay.
Yes, okay.
Fine.
So for you to remember, Zumab, when there is something called Zumab in the prefix ZUMAB, then it is usually a monoclonal antibody.
Okay, clear.
For you people to remember it. Okay, fine. Let's move forward. Sorry. Troponin test is used for. This is very common. We hear it. So without options, can I hear answers? Why do we use troponin test? Okay, I do not see answers. I'll give you options then. Myasthenia gravis, liver damage, myocardial infarction, angina. Sorry. It's very simple. It's something which happens commonly. I'll give you a clue if you find such a condition. When you go into the emergency department, the first test they do will be this troponin test. So which is it? Yes, I see people answering.
Angina.
Yes, okay. Okay, so let's rule out two options. Let's go for two options only. It's not myasthenia gravis. Okay, myasthenia gravis is it is a condition where your jaws and your muscles are affected. So there are different molecular tests which is done for myasthenia gravis. For liver damage, again we have bilirubin levels and those to test. So then we rule out. We come down to myocardial infarction and angina. So now within these two, what is it? Is it angina or myocardial infarction? Okay, so the answer is myocardial infarction, not angina. So troponin test will is also considered as a differentiator if it is an angina or a myocardial infarction. So this is because patients present in various ways. Some patients may totally collapse. There are some patients who will be very alert. They will just complain of slight discomfort and pain or some gastritis like pain. So we may not consider it as serious, but it is actually myocardial infarction. They may be having a heart attack, which they may not present with, but that is not the same case in angina. Okay, myocardial infarction is more severe form of an angina. So the troponin test, we have heard of BNP levels, troponin levels, BNP levels, and all. I think if we see, okay, we'll see some cases also. So you'll just you'll be able to understand it. Okay. So the answer is myocardial infarction. Okay. So this is basically when a heart attack or when there is a myocardial infarction, this is how the skeletal muscle responds. There will be spike in certain proteins in our body. Okay. So those are evaluated by troponin levels. Okay. Though they also tell us at what day or at least which hour an infarct would have happened. But again, the drawback is troponin test is usually valid. I mean, it's the levels of troponins are usually spiked at least for 3 to 4 days. So that is again a disadvantage. So there are other tests to run, but we still use troponin as a gold standard test in myocardial infarction. Okay. Yeah. Let us move on to the next question. The version of good manufacturing practice in India that describe requirement of factory premises for manufacture of cosmetics. Okay, forget about manufacturing of cosmetics. Are you? Can you remember which is the schedule for factory premises? Yes, someone told me. I think
Schedule M.
Schedule. Yes,
Schedule M.
Schedule M. So I'll just give you options: Schedule M, Schedule M1, Schedule M2, and Schedule M3.
M2.
M2. Okay. Any other answers?
In schedule M2 is
Okay. So what does M1 provide then?
Homeopathic.
Homeopathic. Okay. What about M3?
Medical.
Yes. Medical what?
Medical devices.
Medical devices. Correct. Okay. So what are the medical devices that we have very commonly in our practice? Something that is sold on an everyday basis.
injectable needles,
Injectable needles. Yes.
catheters,
Insulin pens. Yes, it is a medical device. Okay. Then anything else?
Pressure
Hearing
monitoring
aids.
Like
Yes, pressure monitoring kits, hearing aids. Then we have blood glucose monitoring kits also. Okay.
that.
So Schedule M, so the answer is Schedule M2. To just reiterate, Schedule M1 is for homeopathic drugs, Schedule M2 is for cosmetics, and Schedule M3 is for medical devices. Okay. Yeah. We'll move to the next question. Drug products that contain the same therapeutic moiety but as different salts, esters, or complexes are called. I'll just give you 5 to 10 seconds for you to read the question. I'll read it again. Drug products that contain the same therapeutic moiety but as different salt, esters, or complexes. Okay, you got the question? I'll give you options. Therapeutic equivalence, pharmaceutical equivalence, pharmaceutical alternative, and therapeutic alternative. So just think about it.
Therapeutic alternatives.
Therapeutic alternatives, okay. Anybody else? For okay, another person says therapeutic equivalent, okay. Okay. Okay, I'll just tell you how to answer such kind of questions. We have two things. We have drug products as the main keyword. We have therapeutic moiety as the main keyword, right? So you told me it may be therapeutic equivalent. But have they mentioned anything about how the drug will behave? Is there any response after taking the drug? That becomes therapeutic equivalent or therapeutic alternative. If they have mentioned anything about how the drug is responding, that becomes therapeutic equivalent or alternative.
Okay.
Here, what do we have? We have salt ester complexes. That means it is still in the pharmaceutical way. It has not gone to therapeutics yet. Okay, they are asking the questions still in the chemical form itself.
Okay.
Okay, so now we rule it out to pharmaceutical equivalent and pharmaceutical alternative. So what may be the answer?
Pharmaceutical alternative.
Alternative,
Pharmaceutical
equivalent,
equivalence.
okay. Anything else?
Pharmaceutical alternative.
Yes, okay. Okay, so the answer is pharmaceutical alternative. Okay, pharmaceutical equivalent is when drug products will have identical dosage form or route of administration, or it will contain certain form of identical active ingredient. Okay, in case of pharmaceutical alternative, what happens is the ultimate action will be the same. Okay, but it will give you the desired action, but the percentage or the dosage form or the dose may be different. For example, lidocaine, we have all we are aware of lidocaine patches, right?
Yes.
It is used for pain. We have all seen lidocaine patches, or belladonna patch for that matter. Yes. Okay, so it may contain a particular active ingredient. For example, in lidocaine patch, the actual amount of active ingredient is 5% lidocaine along with some other ingredient to it. Okay, so for example, the alternative for it may be 4% lidocaine. Okay, with an alternative with some other ingredient to it. So this is it is the same drug, but it is in a different percentage provided, but it gives you the similar action. So it is called pharmaceutical alternative. Okay, you understood? You want me to repeat it again? Yes. Okay, so I think you have got it. So therapeutic you can mention when they are mentioning about how the response to the particular drug is. Okay, just keep that in mind. So now here they have mentioned different salt esters or complex, so that becomes alternative. Okay, yeah. Okay, now let's move on to the next one. Okay, in pharmaceutical equivalence, what happens is it may be of a particular action. I mean, for example, if it is paracetamol, it will give you a particular action of relieving the fever. But a similar compound such as paracetamol may also be used in some cases. Okay, so that is called an equivalent, because it provides the same action as the reference drug. So that is called as an equivalent. Okay, alternative is usually it does not change an active ingredient. Mostly it changes in the dosage form, or for example, something that you are giving, that you have been asked to give orally, you may be giving it as injection for better use. You may advise the patient to take it in that way. So that becomes a pharmaceutical alternative that you are giving to them. So that is an example. Okay. Okay, let's move on to the next question. In case of hypothyroidism, the preferred thyroid preparation is? Yes, any answers? Hypothyroidism drug.
Methimazole.
Hypothyroidism? Is methimazole for hypothyroidism? Okay, methimazole is usually for hyperthyroidism. Okay, I'll give you the options: levothyroxine, dextrothyroxine, leothyronin. None of these. Which one could it be?
Levothyroxine.
Levothyroxine. Okay. What about dextrothyroxine?
Levothyroxine is an active form.
Active form, correct. Okay. So what is leothyronin then?
T3 hormone.
Correct. T3 hormone. It can also be given, synthetic T3 hormones are also available. So the answer is levothyroxine. Anything apart from, see, for hypothyroidism, it's very simple. The prefix will be thyroxine. Most drugs will be thyroxine, ending with thyroxine. So carbimazole, methimazole and all will be for hyperthyroidism. Okay. Okay, so there is one more thing that I want, that I have heard. So I'm just asking you, can you tell me the dosage for thyroxine, or the metric which is used for levothyroxine? What is the metric which is commonly used for levothyroxine? Is it kg, mg, mcg, nanogram? What is used?
MCG, ma'am.
mcg. Okay. Any other answers? Okay, so yes, it is mcg. But when we usually tell patients come and tell us, I've been given 2.5 mg. Okay, so that is something that we need to correct from our end itself. So it is always microgram. We should always tell it is mcg and not mg. Okay, so the metric which is used in hormonal preparations will usually be micrograms. So there's one tip that you can remember. Next question. Lugol's solution contains 5% of iodine. How much of Lugol's solution is administered to a patient thrice daily to provide 60 mg of iodine? I'll also give you the options: 0.2 ml, 0.3 ml, 0.4 ml, 0.5 ml. So you can just use your pen and paper to calculate. It is there is no actual formula to this. It is very, very basic. So just try if you can do this. Lugol is basically, it is for it is an antiseptic. It is present in our spirits. Okay.
0.3 ml.
0.3 ml. So can you tell me how you got 0.3 ml?
5% solution, so 5 gram in 100 ml.
Correct.
So 6 into 60. 5 divided by 100 into 60. 60
Correct.
into mg. அதனால நம்ம
இல்ல,
கிராம்
அப்போ நம்ம
வந்து 1000ல போட்டு.
கரெக்ட். ஆனா நம்ம thrice daily கொடுத்திருக்கோமே, நீங்க அதை விட்டுட்டீங்களா? 3 times கொடுக்கிறோம்.
ஓகே.
So what happens then? Just a second. Anybody else? Any other answers? Okay, so actually the answer is 0.4 ml. Okay, I think we have to work this out. My pointer here isn't working. Just a second. Okay, so you can take it like this. I'm sorry. So it can be, oh, I'm so sorry, it is bad here. 5 grams in, okay. Okay, so you can, okay, this is not very well taken. Okay. So what you can do is you can take 5 grams, you can just mention as 5 gram in 100 ml equal to 3 times of 60 mg. Okay, so you can mention 5x into 100 equal to 3 into 60. 3 into 60 by 100 into 5. Okay, actually I had a slide for this. I think it's missing. Okay, at the end of the class, I'll give you the calculation slide for this. Okay. I think it just missed. Okay, just in case if I forget, please remind me about this question. It's question 63. We'll do it. We'll do the working out at the end of the class. Okay. Okay, can we move forward then? In capsules, rotofill is used for
filling pellets.
Okay, got the answer. Okay, so what is a rotofill then?
Rotofill is an apparatus used to fill pellets.
Okay, apart from pellets, what is rotofill used for? Forget about pharmaceutical industry. Other than that, anything that you're aware of?
No idea.
Inhalation.
I'm sorry?
Inhalation.
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 No.
That Astalin.
Astalin. No. That is rotocap. It is an inhaler. So that is rotocap. This is rotofill. Okay. I'm asking something. Okay. Very basic processed food that we get. We are all aware of cup curds, right? Curds which are available in cups.
Yes, ma'am.
So something which is not very liquidy or which is not very solid. Okay, which has some amount of water content in it. Rotofill apparatus is the best to fill them in. Okay, so it may not be able to fill powders because of the it is more like okay, see, so the apparatus will have two particular so one thing like this, and there is another thing like this. So you will place your pellet here, pellet or capsule or your desired agent here, and this moves up and down at a particular pressure to press on this to fill. Okay, so in case of powders, it may move away. Liquids, again, this is not the right technique to use it, so it is always pellet. So something which is semi-solid in nature, which contains a little amount of moisture in it, rotofill is used. Okay, so the answer here is pellets. Okay, okay. So can you tell me what is the capsule? What is the coating of capsule made of?
Gelatin cell.
Yes, gelatin.
Gelatin.
Okay,
A and
yeah.
B.
Gelatin, earlier days, what was it made of?
Rice
Hmm.
flour. Rice
Yes,
flour.
rice
Starch.
flour. Okay, yeah.
Rice flour.
Yes,
flour.
correct. Okay. So if at all a question comes, what is the coating of capsule, then we can answer it as gelatin. Okay. Yeah. So let us move on to the next question. Sorry. Anticholinergic used as a bronchodilator is.
Ipratropium bromide, tiotropium bromide.
Okay. I'll give you the options also. Pilocarpine, ipratropium, prazosin, atropine. Is everyone okay with ipratropium?
Yes.
Yes. Okay. So can you tell me what is the use of the other drugs then? Pilocarpine, where is it used?
Pilocarpine used in glaucoma. It is an cholinergic drug.
Yes, it is used in
Prazosin
glaucoma.
is one antagonist.
Okay.
Atropine is an anticholinergic.
Okay. Prazosin is also used in what other conditions?
Benign prostate.
Yes.
Benign prostate
Hyperplasia.
This one.
Okay. So any something which is very commonly used. Prazosin is used in also a common disorder.
Antihypertensive.
Antihypertensive. When the patient is not responding to any other drug, then alpha-1 blocker is being given. Okay. So pilocarpine, again, it is for glaucoma and some eye infections also it is being given. Okay. So atropine, why is it given? When is atropine given?
Pre-anesthetic medication.
Pre-anesthetic, okay. In case of emergency use, when is it given?
Opiate poisoning. This is organophosphorus poisoning.
Yes, any kind of insecticides or mushrooms or OP poisoning, atropine is given. So basically what it does is it will reduce all the secretions of the body, because our cholinergic system is responsible for all the secretions, right? So in case of poisoning, we may see an increased secretion of saliva and there may be fluid in respiratory system. So in order to prevent this or to reduce this, atropine is used. Okay, so the answer here is ipratropium bromide. Okay, now tell me, ipratropium bromide, is it how is it available? As a drug? I mean, as a tablet, or how is it available?
Solution. Solution.
Nebulizer, yes. What
Solution
is it
form.
usually? Inhaler?
Inhaler, yes.
Yes, inhaler.
Solution.
So inhalation solution, yes, as for nebulizer, yes, but very, very commonly used as an inhaler along with another drug. Which drug is comes along with ipratropium bromide as an inhaler? What salbutamol?
Levosalbutamol.
Yes. Okay, so levosalbutamol along with ipratropium bromide is available as inhaler and as inhalation solution. Anybody aware of the percentage? I mean, what percentage of ipratropium bromide is used in solution? Inhalation solution.
No.
So it is 0.02%.
Okay.
Okay. So let us just keep this in mind. If at all we get to see such questions, then it will be easy for us to answer them. Okay. So now let's move on to the next question. All except dash are antibiotics obtained from fungi. Your options are penicillin, griseofulvin, cephalosporin, bacitracin. Okay, so these are, okay, this is a actually kind of tricky also, because we do not expect antibiotics to be obtained from fungi, but that is how it is being happening. So they are grown and then they are grown out of molds, a lot of molds from fungi organisms, and then they are being produced. Okay, so which is the one? Selva Ganesh has answered yes. Bacitracin. Anybody else?
Penicillin.
Penicillin. Okay.
Acid.
Okay, so the answer is bacitracin. Okay, penicillin is also obtained from a particular fungi called Penicillium something. I'm not very aware of. I'm remembering.
Penicillium griseosinum.
Yeah, I think, but I'm not very sure of what that is. Okay, so bacitracin here is obtained, is not obtained from a fungus.
It is a bacteria.
It's obtained from microorganism itself. It's obtained from a bacteria itself, bacitracin. Okay. Okay, now let's move. Okay, bacitracin ointments, where do we see? In what is it usually seen as? It comes as a therapy. It comes as a triple therapy. 3 things come along with it. It's summer season, so just remember about the summer dusting powders that we use. I think you may remember.
Yes.
Yes. Heard about neomycin and polymyxin with bacitracin?
Yes.
In case of rashes, so this triple therapy is very commonly used, and in case of some skin injuries, bacitracin alone is given. Okay, so have you heard of Neosporin?
Neosporin ointment, yes.
Neosporin, yes, ointment, yes. So that has 3 things in it. One is bacitracin, and it will have polymyxin and neomycin. Okay. Yeah. Okay. Fine, then let's move on to the next question. Trachoma is the disease of skin, eye, thyroid gland, ear. Eye. Okay. Anybody else? What about skin? No.
Dermatitis.
Okay, so the answer is not eye, but it okay, yeah, it is eye, but it can be confused with ear also, because our eustachian tube, the tube that leads from our eardrum, right? So that is sometimes called tracheae. So we may mistake it with ear, but the answer is eye. Okay, so what is trachoma? Any idea what is trachoma? Is it a bacterial condition or viral condition? What is it? Okay, so it is caused from the bacteria Chlamydia trachomatis. Okay, so it is a bacterial infection which happens, and usually it is transmitted through contact from infected people, and in some cases it may lead to blindness, but it is a preventable blindness. So the person may be blind for some a period of time, and then they can revive back their eyesight, depending on the severity of the infection. Okay, so that is trachoma by chlamydia. Okay, bacteria chlamydia trachomatis. Okay, so can you tell me one disease of the skin?
Leprosy.
Okay, leprosy.
Psoriasis.
Psoriasis, yes.
Psoriasis.
Okay. Correct. Okay. Any other disease of eye apart from trachoma?
Conjunctivitis.
Conjunctivitis, yes. Glaucoma.
Yes, glaucoma.
Yes.
Increased
Glaucoma.
blood pressure.
Okay, fine. So what about thyroid gland? We know we have hyper and hypothyroidism. We have goiter. Okay. So what about ear? Very, very, very common disease in the ear. What is it? I'm sorry, I didn't hear you properly. Fungal infection in the ear. How many of us have heard it? Otitis media. You may have severe ear pain along with neck pain with a fever. It's very, very common condition in people who use buds very regularly, earbuds, and very common condition in children also. Okay. So otitis media is one major disease of ear. Okay. Yeah. Okay. Now let's move on to the next question. Icterus index is associated with healthy kids, neonatal jaundice, anemic mother, and in tongue-tie surgery. So any idea? Okay, Raj Lakshmi has answered neonatal jaundice. Okay, any other answers? D, tongue-tie surgery. Okay. Okay, what is icterus? Have we seen it somewhere? Anybody who's done M.Pharm in pharmacy practice or PharmD, or you or any pharmacists who are seeing inpatient files, you may be aware about icterus. You will have a box, right, which says pallor, icterus, swelling. So you may have to put positive or negative. No? Okay, I'll tell you. Icterus is basically the first sign to check for jaundice. And why it is called an icterus index is because of the okay, usually jaundice is associated with yellow color, right? So it is the color of the serum bilirubin. So icterus index is to determine the extent of the yellowishness in children. Okay, so there is a patch which has different icterus colors, different yellow colors, which will give you to what extent that hepatitis or jaundice is present in that particular child. There are also other tests which are performed, but just in order to see if the patient, if the child is responding to phototherapy, then an icterus index is used. Okay, so it is just a strip which will have different colors of yellow in it. Okay, so the answer is neonatal jaundice. Okay, yeah. So let us move on to the next question. Which of the following types of adverse drug reactions is not believed to be dose dependent? Okay, I'll give you options. Side effects and reaction, toxic reaction and hypersensitivity, side effects and hypersensitivity, hypersensitivity and idiosyncrasy. So which of the following types of adverse drug reactions is not believed to be dose dependent? We can rule out one by one.
Hypersensitivity and idiosyncrasy.
Okay. Why do you say so? Okay, so what happens in side effects or reaction? Should it be dose dependent? Is it necessary for it to be dose dependent? No. Okay, so a particular patient may not be tolerant to drug. For example, if you are giving a sulfa drug, sulfamethoxazole to a patient, or sulfoxazole to a patient, the patient may be allergic to sulfa drugs itself. So he or she may have a reaction or a side effect. That is for tolerance. So that is not attributed to dose. Next one, toxic reaction or hypersensitivity. Is it dose dependent again? It may not be dose dependent because we may present in a different manner. So we may be hypersensitive to few drugs according to our genetic makeup. So it cannot be toxic reaction and hypersensitivity. Okay. Side effects and hypersensitivity, again, no. Side effects can be not just dose dependent. It can be attributed to various other reasons also. So last one is hypersensitivity and idiosyncrasy. So what is idiosyncrasy?
Drug tolerance.
Drug tolerance.
Right, drug tolerance. Okay.
Specific enzyme is option.
Oh, no, just give me what is the meaning of being idiosyncratic?
Genetically
Unexpected drug response.
Okay.
Example G6PD.
G6PD. Okay. It's just unusual behavior of us. Okay. If we don't have to think only medically. Idiosyncrasy is not the right behavior, or it may be unusual than other behaviors. So if your body is a fast metabolizer, for example, so it may metabolize a particular drug very fastly and it may not show any effect. Okay, so that could cause a reaction, that may not cause a reaction. So what the patient may think, the physician may think, okay, this patient is not responding, let us increase the dose. So what happens? The patient tends to have nothing but the patient will just metabolize the drug. There will be nothing related to dose there. So as you said, yes, G6PD deficiency, it is particular to a particular patient. So it is not believed to be dose dependent at all. So hypersensitivity and idiosyncrasy. Here mainly idiosyncrasy is what we will bring into matter because of the different genetic makeups that we have, the different metabolites that we possess, then the different liver metabolizing enzymes, like for example cytochromes. We have all heard cytochromes, right? So that might be different for each individual. So that is called idiosyncratic. That means you're unusual from other people. Okay, so the answer here is hypersensitivity and idiosyncrasy, right? Okay, so let us move to the next question. Infected blood products may produce serum hepatitis due to the presence of hepatitis A virus, hepatitis B, hepatitis C, and none of the above.
Hepatitis B virus.
Hepatitis B, okay. Sorry.
B
I'm sorry.
virus.
B virus. Okay. Why B virus?
In blood, B viruses are.
Okay. Okay. Actually, A, B, C, all of it is present in the blood. So we have to see this in terms of how it is being spread. Okay. So how is hepatitis A spread?
Or optical route.
It is only through contaminated food or water. Okay. Hepatitis A is spread in that way. Hepatitis B.
Blood.
Contaminated
Blood,
needle.
exactly. Any bodily fluids, contaminated needle will become hepatitis C, but usually only blood products or any other bodily fluids, right? So that is hepatitis B virus.
C, tattooing and needle.
Yes, tattooing and by sharing needles, hepatitis C will be the cause. So the answer for this is hepatitis B virus. Which one of the following glucose transporter is a new drug target for the management of type 2 diabetes? Options: SGLT2, sodium glucose link transporter 2, glucose transporter 1, sodium glucose linked transporter 1, and glucose transporter 2. So which do you think is the newer drug target to manage type 2 diabetes? No idea?
SGLT2.
SGLT2, okay. Here the important keyword is new drug target. Okay, so the answer is SGLT2. But okay, actually, I'm sorry, the answer mentioned here is wrong. SGLT1 is the newer drug target for the management. I'll just change it here, 1 second. So it is SGLT1. Okay, so what does SGLT2 do? Where does it act? Okay, so SGLT2 acts on your kidney tubules, okay, where there is glucose transporter present. SGLT1, it acts on reducing the glucose absorption in the small intestine itself. Okay, so SGLT2 is more lower near the renal tubules, but SGLT1 is reabsorbing in the smaller intestine. So it is there are no actual drugs as such for SGLT2 yet. So it is just a newer target, but it is not in therapy yet. Okay. So can you give me examples of SGLT2 inhibitors?
Dapagliflozin, dapagliflozin.
Dapagliflozin.
Yes. Okay. Very good. Okay. So what is a major side effect of glyphosins? Okay. So the very, very common side effect of glyphosins are causing of urinary tract infections, and in females, vaginal infections due to the extreme deposition of glucose from urine. So it gets expelled out. Glucose gets expelled out in urine, right? So you have higher deposits in urinary bladder and your reproductive, because your reproductive organ is quite near to urinary bladder. So there are high chances of microbial growth, which causes the major side effect, that is the urinary tract infection or vaginal infections in genital infections, more specifically in women. Okay. SGLT1, we actually do not have a drug as such, but it is just a target which is being researched. Okay. Yeah. Let us move on to the next one. Which of the following drugs possesses antiplatelet effects? Options: erythropoietin, urokinase, desmopressin, clopidogrel.
Clopidogrel.
Oh,
Clopidogrel.
clopidogrel. Okay, not urokinase. It is clopidogrel. Okay, so what is urokinase? Where who gives urokinase? Which organ gives urokinase? Okay, urokinase is actually an enzyme which is present, which is made in the kidney. Okay, so in cases where there are clots in lungs, where there is pulmonary embolisms, urokinase is used as injection. Okay, so erythropoietin. What does erythropoietin do?
To increase blood level to brain.
Increase blood levels to brain. Yes. Anything else? Blood levels to brain or anything specific?
Specific means blood flow. There is the average
No,
blood
no,
flow
no.
to
It will increase the production of red blood cells.
Okay, okay.
Okay, not blood flow, just increase the production of red blood cells. So in patients who are very, very anemic, erythropoietin injections are also given along with oral supplements. Okay. Okay. Then what is desmopressin?
Vasodilators.
Vasodilator, yes. What is it used? I mean, in which condition is it used?
It reduces the continuation of urination, I think.
Correct. It is an antidiuretic hormone.
Antidiuretic hormones. It
Okay,
reduces the
so it
continuation.
is very, very commonly used in type 1 diabetes. It is one of the most commonly used drugs in type 1 diabetes apart from insulin. Okay, diabetes insipidus. It is also called water drug. Okay. Okay, so the answer here is clopidogrel. Okay, we'll move on to the next one. Which one of the following is most likely positive sign of pregnancy when detected in urine? Estrogens, progesterone, HCG, human chorionic gonadotropin, and corticotropic hormone.
HCG.
Estrogen, okay. Anything else?
It's HCG, ma'am.
HCG, okay. Okay, so the answer is, the answer is human chorionic gonadotropin hormone. Again, the key here is there is the presence of the term chorio. So we learned previously also, right? Chorio means something related to the placental cord. Okay, so that is in pregnancy. So you can just relate it like that to answer. Estrogen, progesterone, yes, it is present normally also, but in pregnancy, there is human chorionic gonadotropin hormone. Okay, yeah. I've just mentioned it wrong here. I'll correct it later. Okay, so we'll move to the next one. Increased serum levels of which one of the following may be associated with decreased risk of atherosclerosis? VLDL, LDL, HDL, total cholesterol.
HDL.
HDL, okay. Anything else?
LDL.
LDL, okay. I think you got the question wrong. Decreased risk of atherosclerosis. So what is it, HDL or LDL?
Low density lipids, right?
So basically the question is
LDL is a bad cholesterol.
correct.
Yeah,
So
it's a bad.
it is
also deposition of fat in the heart walls.
heart walls. Which one? LDL. LDL is bad cholesterol. HDL is your good cholesterol. So this is attributed to reduced risk of atherosclerosis.
Okay.
Okay.
HDL.
Yeah, so not LDL. So just remember, actually this question was not designed in such a way. This question was designed as with increased risk of atherosclerosis, but I just changed. So we be careful with the terms that we concentrate on. Okay, so here it is increased serum levels, but decreased risk of atherosclerosis. So please take time to read questions and then answer. Okay, so the answer is HDL. Okay. Metformin causes the following actions except for the one identified. Reduces hepatic neoglucogenesis, increases glucose uptake in skeletal muscles, enhances sensitivity to insulin, increases HbA1c by 1 to 2%. What is the answer? Metformin, you just remember what is the action of metformin?
Reduces hepatic gluconeogenesis.
Okay, please see the options correctly.
Except
Okay, so what is the whole idea of giving an anti-diabetic drug? To reduce your glucose levels, right? Ultimately, it is to reduce
glucose level.
HbA1c. See this. What is this? Increase HbA1c by 1 to 2%. Is it right? Will it increase or will it reduce?
Reduce.
Yes. Okay. So this is very simple question. So please remember to read all the options rightly. So it does all the other things. It will reduce newer formation of glucose in liver cells. It will uptake all the glucose from skeletal muscles. Then it will enhance the sensitivity to insulin to form glucagon. But it should basically decrease your HbA1c by 1 to 2%. I mean, whatever percentage, right? So the answer is increase HbA1c by 1 to 2%. We can actually go wrong with technical answers, but these questions are very logical questions. So we can answer it very quickly. Just we need to read it properly. Okay. Yeah. Let's move on to the next one. Okay, 1 second. Sorry. All the first line TB drugs are bactericidal except A. INH, isoniazid hydrogen, B. rifampicin, ethambutol, and pyrazinamide. So which do you think is not bactericidal?
ethambutol.
Ethambutol, okay. Anything else?
Isoniazid.
Isoniazid.
Okay. Okay, so ethambutol, who answered? Okay, why did you tell it is ethambutol?
It's a bacteriostatic.
Exactly. Okay, so that is the answer. Okay, so the answer is ethambutol, whereas isoniazid, rifampicin, and pyrazinamide, these are drugs which will kill the bacteria, kill the tuberculosis, Mycobacterium tuberculi bacteria. Ethambutol will help in reducing the growth, not by killing completely. So that is why there is always a combination therapy which is given. Okay. So the answer is ethambutol. Okay. So next one. Painful or difficult urination is called as oliguria, dysuria, polyuria, hematuria.
Cystiria.
Dysuria, okay. Oliguria, not oliguria. Okay. Yes, it is dysuria. So for you to remember, discomfort means difficulty or painful. So you can just use remember that term, discomfort. That means it is painful or difficult urination is dysuria. Okay. So what is oliguria? Very, very low. It is low urination is called oliguria. Okay. What is polyuria?
Frequent urination.
Yes, increased urination. Hematuria?
Blood in urea.
Blood in urine. Okay, not urea. Blood in urine. Okay, so the answer for painful or difficult urination is dysuria. Okay, let's move on to the next one. Okay, giardiasis is caused by a virus, a protozoa, a bacteria, or a fungi. Which one?
Fungi.
Bacteria.
Bacteria. Okay. Okay, what is giardiasis? Any idea? Okay, it is basically dysentery. Dysentery. Okay, so just remember this iasis. Last class we saw about filariasis, right? So we attributed it to one particular term. What is it? Iasis means you can attribute it to protozoa. Any kind of protozoal or parasitic infection. Okay, so that will end in IASIS or at least ASIS. Okay, so any disease which is due to protozoa will end with IASIS. It is just a trick to remember. Okay, so usually bacteria will be itis, mycobacteria. You will have any form of bacter in it. Okay, but for protozoa it is very clear. We have filariasis, we have amoebiosis. All these are parasites which are protozoal parasites. Okay. Okay, so let us move to the next question. Angioedema is the adverse reaction affecting liver, skin, pancreas, GI tract.
Skin, ma'am.
Okay.
Skin.
Any other answers? Okay, so tell me, why is it skin? Why did you answer it as skin?
The angioedema is a disease caused by the head, ma'am, like red
Disease?
pigmentation.
No. Please do not use the term disease for angioedema. It is just a symptom or a sign. Okay, it is usually it is a sign which is of an underlying disease condition. Maybe due to a kidney disease, it presents as angioedema or edema, but angioedema itself is not called a disease. Okay. Okay, so what is edema?
Swelling.
Swelling, correct. So what is angioedema? Angio means what? What is angiogram, angiography? What does it deal with?
Transplantation of organ.
No. Angiogram?
Vessel.
Yes, correct. Blood vessels. So angio is nothing but blood vessels. Edema means swelling in your blood vessels. Usually angioedema is peripheral organ swellings, like for example your feet or your under your eye swelling or your neck swelling is called or your finger swelling is called edema, angioedema. And where do we see it first? We do not see it in liver, pancreas or GI tract. The immediate organ is skin. Okay. So the answer is skin. Okay. Yeah. Now let us move on to the next question. Calcitonin is secreted by adrenal, parathyroid, thymus, thyroid.
Thyroid.
Okay, thyroid.
Thyroid.
Any other? What does calcitonin do? Yes, it is thyroid. So calcitonin is basically to it is secreted by thyroid glands, and it helps in regulating your calcium levels in the body. Okay. If there is high amount of calcium in your body, then calcitonin hormone is produced more, so that it helps regulate your blood calcium levels. Okay. So I think we've done around 30 questions today. Okay, so just quickly tell me, how did you feel today's session? I mean, today's questions and yesterday. Was it slightly complex than yesterday?
Yes.
Yes. So we'll do a mixture of these questions along with the kind of questions yesterday also. So it becomes easy for us. It will help our mind think a little bit more. Okay. So, okay. Now we have another 10 minutes. So let me just give a quick overview. Just 1 second. Okay, so I'll just run through very quickly, and this was, I think, some unit 2 in the syllabus. As much as possible, what I've tried to do is I've not gone into details of anything. Whatever topics they have mentioned there, I've just tried to at least stick on to it. Let us know what it is, and that is more than enough because of the restriction of time. So probably definition, or if there is something very, very important, then we will see. And most importantly, the way I have prepared is the way the questions are being asked. Okay, so it may not be very much in detail, but if you want something in detail, please do let me know. We can do that. Okay. Yes, Priyadarshini and Kaushik, anything you have to share?
Yes, ma'am. Ma'am, you said that you will solve the sum at the end of
Yes,
the
yes.
section, ma'am.
Yeah,
The
yeah, yeah.
63 question number, I think so.
Yeah, yeah. Let's finish this and go for it. Okay.
Okay, ma'am. Thank you, ma'am.
Yeah. Okay, fine. Okay, so this is all about prescriptions. I think yesterday we had a few questions like what is RX, and based on that we had a few discussions. Like a few of them told me it is inscription, subscription, and all that. Okay, so we know all of this. So this is just a systematic way of telling you what is in a prescription. Everything is aware to you. Nothing is very new. Let us just brush up our basics in this. Okay. Okay, so in this we will be just having what is a prescription. We'll have what are the parts of a prescription. Then we'll have Latin terms and abbreviations which are used, which was very important question, which kept coming again and again. Then how do we handle a prescription and errors in prescription? Okay, so now I want any one of you to tell me what is a, just define, not define, tell me in your own words what a prescription is. You can just have this picture in mind, and can you just give me a few keywords that can be used in a definition for what is a prescription? Anybody?
Prescription is a written form given to pharmacist from physician to compound the medicine
Okay. Okay. You told most of it right. You just forgot one thing. You have the patient also here. So
Yes,
can
ma'am.
you just rephrase it a little bit?
Yes, ma'am. Prescription is a written form
Correct.
given to pharmacist from a physician. Pharmacist give to patient.
Okay. Yeah. Actually, it means the same. But if you just see the arrow, then you will. You can tell it even more clearly. But what you meant is right. Exactly. Very good. Okay. So prescription is a written order from a registered medical practitioner to a pharmacist to compound and dispense a specific medication for a patient. Okay, but does this usually happen? Does the doctor give the prescription to a pharmacist? Who gets the
No.
prescription?
ma'am.
The patient gets the prescription, right?
Yes, ma'am.
Okay. So
Yes, ma'am.
then we can see this is a definition, so we cannot actually change, but it can just be slightly rechanged as prescription is a written order from a medical practitioner through a patient to a pharmacist. Okay, so that is why we have the sequence as the doctor, the patient, and the pharmacist, right? So we have 3-4 terms which we need to remember: written order, or for that matter, now we have digital order, right? So it is just a printed form, then registered medical practitioner, pharmacist, and patient. So these are the 3 terms that we have to remember. Okay, so next one, what does a prescription contain? So we have all seen what a prescription is, right? So but each of it has a name. So we will just go through the names because these are all repeated questions which are being asked. So let us just brush up about it. So prescription will contain a prescriber's information, the date, name, age, and gender of the patient. You have superscription, which is the symbol RX, that is take thou. Then comes the body of the prescription, that is the medication which is prescribed. It is also called as inscription. Then it is subscription, that is the direction which is given to a pharmacist. Then it is signature or transcription, that is direction for the patient. And then you have renewal instructions. You have prescriber's signature and registration number. Out of all this, we may not see commonly 2 things. One is subscription, that is direction to the pharmacist. Second is renewal instructions. This is usually not seen now, but a classic prescription will have all these elements in it. Okay. Okay, so the parts of prescription. Firstly, it will have the prescriber's information. So what is very important is the name of the doctor, contact details if yes or no, but what is very important is a medical registration number. Okay, so date. Why do we have to have a date? It will tell you when the patient has actually visited the doctor and when the prescription is being given. This is very, very important in narcotic drugs because the patients tend to keep coming back in order to get the drugs again. Okay, so that is why date is very important. Again, next is name. That is fine to identify the patient. Then you have age. This is very, very important in pediatric and geriatric population. Nowadays, we do not have to do any dose calculations, but earlier days, it was just given to the pharmacist. The pharmacist will do the dose calculation and accordingly get approval from the doctor to dispense it. Weight and height, it is preferred but usually not given, and this is usually seen only in obese patients. Gender, okay, so gender again, why? Because of the way metabolization happens. This we will see later. So some of the drugs, women tend to metabolize more quickly and try to get the effect quickly, whereas males will take more time. So there are a few factors there which we'll see later. Okay, So again, what is superscription? It is a symbol Rx. So it is take thou, as discussed yesterday. So it is believed to be the symbol of Jupiter, who helps in quick healing. So it is basically more of praying to the god of Jupiter to heal the particular patient. Okay, what is the inscription then? So this is the main part of the prescription. So it will contain the name of the drug and the quantity of the drug, that is the dosage of the drug. So usually official preparations, that is we usually nowadays it is only official preparations which are being given. So example, we have the pharmacopoeia which has the preparation name. So for example, paracetamol 500 mg. So it will just be given that way. In case of non-official preparation, that means you will have to, if the pharmacist has to prepare the preparation, then each ingredient will be given. For example, sodium chloride. So along with sodium chloride, what is the active ingredient? It will be given, and there will also be a note saying how it needs to be made, as in what dosage form it needs to be made. So that is called a non-official preparation. This is usually not used much, but can anyone tell me, I mean, I will not call it as a non-official preparation, but a preparation that is done and then given to patients. Have we seen anything like that? Any common preparations? Or at least you educate the patients to prepare and then use? Anything like that? Okay, some form of powdered antibiotics. There is also sterile water, right? So you tell the patients to mix the water and then use it. Yeah,
Yes,
okay.
ma'am.
So reconstitution for use will be provided there. So that is also a preparation. Initially, it was being done only by a pharmacist, but nowadays the patients and other healthcare professionals also do it. Okay. So next one is a subscription, which is a direction to the pharmacist. This is also not very prevalent now. It is the dosage form which is to be prepared, and the number of doses to be given. So this number of doses to be given can also be in the direction to patient, but it can come either ways. It can also be in the subscription or in the signature. So next will be the signature, which is the instructions which are given to the patients, which says the quantity of the drug, then the frequency, how many times to take, sometimes the route of administration, usually not route of administration. Okay, so you people give me an example. Route of administration for which common drug we tell them? We tell the patient about route of administration. Very, very common drug. Yes.
Sublingual.
Insulin. Sublingual, right? Very good. Insulin, very, very common. Yes, we tell them to rotate the site of injection. We tell them not to make it intravenous, right? It should be intramuscular or subcutaneous. We do tell them about it, right? Okay, so route of yes. So what about special instructions that we give? Any special instructions?
Shake the bottle before use.
Correct, yes. Shake the bottle before use. Anything else related to food? Anything
Take
related to
before
food?
half
Can
an
you
hour
remember?
before food.
Exactly.
And
What drugs?
Don't drink milk while taking calcium.
antacid.
Antacid. Okay, so I think we are hearing some disturbance. Can you please mute your audio? Like background noise is there. I'm not sure whose it is. Okay. Okay. Yes, correct. Antacids. So those are special instructions which we provide. Okay. Renewal instructions. So that is basically for if at all the patient is taking drug for 2 to 3 months. Some patients may take antibiotics for 2 to 3 months in case of tuberculosis, for that matter, or in case of Which other disease? There are 2-3 months therapy. There is peptic ulcer disease, which requires a month therapy initially. So these require renewal instructions which has to be given. So this is very, very helpful in narcotic drugs or antipsychotic drugs. So basically all the habit forming drugs, this is very useful, but it is not very much followed right now. Then we have the prescription signature and registration number if the registration number is not present earlier. Okay. So it is 9:06, but can I just take another 10 minutes? Is it okay with you all?
Okay, ma'am.
No problem.
Yes, ma'am.
So let us just brush through prescription alone. So at least next class we can go to the other overview. Okay. So I'll take 10-15 minutes, not more than that. Okay. So this is the common Latin terms. This I will provide this to you. So antecibum is before meals. BID is twice a day. GT is drop. HS is hora somni. So here, let me just tell you, somni. Somni means sleep. Somniferous animals or somniferous we call people who sleep too much. Okay, so they are called somniferous. So somni means bedtime. So you don't have to remember hora and all. Just somni, if you are able to remember, you can mention it as bedtime. So oculus dexter means right eye. Oculus sinister is left eye. So per os, PO. So we usually call this as per oral also nowadays. So it is by mouth. PC is post sibum. So that is after meals. PRN is prore neta, as needed. Q 3 hours. Q means every. Sorry. So it is every 3 hours. QD means every day. QID is every 4 hours. TID is thrice a day. So there are actually a lot more Latin terms. There are close to 100 Latin terms, but these are very, very few, which is very commonly used. So I think let us not confuse more than this. Probably another 10 I will give you. Okay, so you can just have a look at that. Okay, so now we have something called modern methods of prescription. Okay. Okay, so can anyone tell me what is a modern method of prescription?
E-prescription.
Okay, e-prescription, yes. Anything else? Correct, the e-prescription is very right, but there is another thing also. Apart from a pharmacist dispensing it to the patient, can you think about it in hospital setup, in an inpatient setup?
Yes, they have a specific software for dispensing medicine.
Yes, so there is a system as such for prescribing. So all those come into modern prescription system. One thing that we all have to remember is the moment anybody tells pharmacist, we only think of medical shops and we being in medical shops, but no, we play a very, very bigger role than being in medical shops. We play a very big role in hospitals. So we are there will be a change that we can see. So even while we are thinking, we have to think in terms of the bigger healthcare community, but and not just not just pharmacy, not just dispensing. Okay. So why basically do we have modern methods of prescription is because we already have majority of the drugs as ready formulations. Our role of compounding a medicine has reduced a lot. So you don't have to compound and dispense it. You just can hand it over to the patients. So initially the goal was to compound and then dispense and then provide counseling. Now the goal of the pharmacist itself has revised. So it is just hand over the ready-made preparations to the patients and provide advice regarding dose and frequency. That too only if they ask for it. because most of us think doctors must have told. Okay, so very few pharmacists provide counseling also when they hand over medications. Then, as you said, yes, use of technology. Then Latin terms, yes, they are avoided now. We don't use much of Latin terms, so it is ease of use. So it is very precise, accurate, easily readable, and we do not use the imperial system. We use the metric system for the convenience of patients. We only use micrograms or mg or mcg, and we don't use something like gallon and all. Okay, so those were the practice. We don't use ounces right now. So those were all traditional methods of a prescription. Now that we have all advanced into all these things, there are modern methods of prescription available now. Okay, so next, let us just move to how dispensing calculations are done. We have two systems. All we have to do is just remember the names of the system and just briefly remember what it is. One is the imperial system, one is the metric system. So imperial system is old system of weights and measures. That's again divided into two. Avoir-Dupuis system, apothecary system. So these were questions which were asked in, I think, in the year 2002 or something about these systems. So that's why I've mentioned it here. So Avoir-Dupuis system, it uses pounds and ounces as unit of measurement. So it was not on basis of grams or kgs before. So it was only pounds and ounces which were used. Apothecary system, they used grains as the unit of measurement. They also used gallon for the measurement. So why all this is because pharmacists used to prepare medications in bulk, as in a drugstore or a pharmacy would have an in-house manufacturing setup. Probably, when I mean a manufacturing setup, it is just one house which where pharmacists used to give medicines. So they used to make in larger quantities. So they used such terms like pounds, ounces, grains, and gallons. Okay, so this question again had come. Gallon is used for the measurement of capacity. Okay, it is only used for liquid dosage forms, not for solid dosage forms. So this is something that we can remember. Okay, so next one. Okay, so this imperial system was quite difficult for us to use because we are not very aware of all their ounce and pounds, and it was difficult for conversions to happen. So metric system was implemented in India in 1964. Okay, so basically metric system is the day-to-day things what we use: kg, gram, milligram, microgram, nanogram, all those things. And in case of powdered forms or dry pills, they will usually have a label on them as to what it is called. Okay, but otherwise it is only kg, mg, micrograms that we commonly use. Again, this was another question. When was metric system implemented in India? So it is in the year 1964. Okay, yeah. So let us just move to the next one. Okay, so we just saw the basics of what happens, what is present in a prescription. So we will just see what are incompatibilities or what can go wrong in a prescription, where errors can occur in a prescription. So error can occur when the drug is being manufactured. Now it is being reduced a lot because of the advent of technology. Then it can be in dispensing. So when we may tend to give another medicine, so that can be a dispensing error. A formulation error. For example, if the patient is being asked a solid dosage form, we may give them a liquid dosage form. So that is a formulation error. Then storage. So insulin is said to be stored in the cabinets of on the side shelves of the refrigerator. So what if you store it in the freezer and then give it to them? Then the ingredient's activeness is reduced. Okay, the activity of the ingredient will go down. So that is a storage error. Then we have the manufacturing error, which is again similar to the compounding error. Administration error, this is usually not in our hands. This is usually in the patient's hand or in the nurses or the doctor's hand. So these are all contributing, or these are all collectively called an incompatibility in a prescription or errors in a prescription. Okay, so what happens during an incompatibility is an undesirable product, or it is a product that you are not you don't desire to see. So it may affect the safety, appearance and stability of the drug. So that is an incompatibility of a prescription. So we have three types. One is physical, one is chemical, one is therapeutic. So in cases of physical incompatibility, for example, if you're mixing two drug substances, maybe the physical nature of the drug will not mix together. So that may tend to form an unacceptable form of a drug. That is, in the looks, it may be different in the looks, or it may be different in the form, the way it is being taken. Okay, so that is physical incompatibility. So it is mainly in the appearance of a drug. So how to correct such incompatibility? Change the order of mixing. So for example, we know each of them have different pH, right? So according to their pH, we can change it. Then in emulsification, if you require an emulsification agent, then it helps in the solubility. So that is helpful here. Addition of suspending agent. For example, you need to add sodium chloride so that a particular crystal is getting solubilized. Then sodium chloride will act as a suspending agent. Or you can even change the form of ingredients. For example, if a powdered form of a drug is not very effectively mixing together, then what do? If you have an alternate, which is a liquid formulation, then you can also use that for the drug substance to be mixed. Okay, so those are physical incompatibilities. We have chemical incompatibilities. This is usually due to chemical interaction. What we have to remember here is it can be due to what reaction? Oxidation reduction or hydrolysis reaction, and that is of two types. It can either be precipitation or drug-drug interaction. Precipitation is basically when there is a pH change, or when there is a chemical reaction, there is a quick change. And in a drug-drug reaction, we can really not make much of a difference here, because it will be after prescribing the drug, after the drug is being taken, this occurs. Okay. Okay, so the last one is therapeutic incompatibility. So this will be if the patient is being prescribed a drug for a specific action, but that particular action is not observed. You may get a different action. So that is called therapeutic incompatibility. So what could be the reasons for it? There could be improper, wrong dosage, or there could be a drug interaction, or there could be supporting drugs which may not let the drug provide the specific action. Okay, so those are synergistic and antagonistic effects of a drug. So these are enough for that unit. So we must have covered a very, very basic overview of what is a definition. We have seen what are the parts. We have seen the Latin terms and abbreviations used. We have seen handling of prescription. That is, initially we used to handle the prescription by counseling and all, but right now again it is not there. Then errors in prescription, that is using all the, like we saw what are the incompatibilities, right? So those are all errors in prescription. So this is one very, very small chapter that I thought we will start off with. So like this, whatever chapters are there, which are where the questions are very relevant, we can take it up. I mean, the questions are repeatedly coming. We will take it up and we will start doing it again. Okay, the complex ones, I think complex chapters, we can keep it to the end. Okay, so everybody is clear now. You at least were able, I mean, everything is known, but you were at least able to brush up your topics, right? Yes.
Yes, ma'am.
Yeah. Yeah. Okay. Okay. So this solving this sum, no, I will just put it as a slide, and in the next class I will give it to you, because I will just give that to you first thing in the next class. Okay.
Okay.
Yeah. Okay. Okay. Fine then. Fine. Okay. So anything that you have to ask? Any queries that you have? We will see how to club. Probably we can do more of questions and then one overview and then questions again. Let us try to do that way also and see how it works. Okay.
Okay.
Yeah. Okay. So thank you so much, everybody.
Thank you, ma'am.
Yeah.
Thank you.
We'll meet next tomorrow. Okay. Yeah. Bye. Thank you.
Thank you, ma'am.
Yeah. Thank you so much.